everyone. My name is Dr. Jennifer T. Kelly, and I'd like to welcome you to the Q&A on cataract today. We have a panel of three that I'd like to introduce to you. We have Dr. Jeffrey Diskin and Dr. Gary Keolian, who are our founding physicians and two of our cataract surgeons, and Dr. Bernie T. Kelly, who is our Director of Refractive Surgery. And we're just going to do a quick Q&A on cataracts, and I'd just like to take a second here to let each of them say hello and introduce themselves, starting with Dr. Jeff.
Thank you, Dr. T. Kelly. It's a pleasure to be here, and hopefully we'll be able to answer any questions about cataract surgery, and let me know how I can help.
And Dr. Gary can say hello.
Hi, I'm Dr. Gary Keolian, and as Dr. T. Kelly said, one of the founding partners at Michigan Eye Institute. Done cataract surgery for almost 30 years now, and hopefully you can answer any questions pertaining to the cataracts and surgery.
And Dr. Bernie?
I'm Dr. Bernie T. Kelly, and I am the Director of Refractive Surgery at Michigan Eye Institute. Been with the practice for starting on 14 years, been in practice for 22 years in the area of refractive surgery.
All right, so a couple of the questions that we get a lot from patients, and a misinterpretation many of the times, is what is a cataract? A lot of patients think it's actually a film growing over their eye, but as we know, it is not. Can one of you take that question and actually describe what a cataract is?
Sure, I'll start. What the cataract is, the normal eye has a lens which focuses light, and a cataract simply means that the lens of the eye becomes cloudy. And that cloudiness can start anywhere from infancy to older ages. And as you get older, it is more common for the cataract to take hold and start to obscure the vision. But in short, cataract is just the normal lens of the eye that becomes cloudy and opacified.
Another question that we get is, how does a patient know that they have cataracts?
Well, I'll take that one. What I tell my patients is that all of us, probably close to 100% of people around the age of 50, if we look under the microscope, we'll see changes of the lens of the eye of a cataract. It just starts to become more yellowish, more brownish, more cloudy, and that's totally normal, totally expected in all of us. The first sign that something may be changing is the vision quality itself. And the complaints that patients will mention usually will relate to activities of daily living. So driving at nighttime becomes more difficult due to glare, maybe needing a brighter light for reading, TV, noticing that it's difficult to either see the picture, the print that goes across the TV. I would say those are probably the most common complaints that we hear from patients that most likely is due to a cataract.
Good. There are several different types of implants on the market right now, and patients really get confused as far as what is best for them. Can one of you kind of briefly give an overview of the main types of implants on the market and how we determine what is best for a patient?
I'd be happy to field that question. There are several types of lens implants that are available to patients, and the three broad categories are what's called a monofocal lens implant. There's an astigmatism correcting lens implant, and there's also one that produces a multifocal effect, allowing patients to see both at distance, intermediate, and in the near range. Now, many patients that have cataract surgery have a desire to be less dependent on glasses after cataract surgery. And with the technology that's available to us today, we can help patients achieve that vision goal. There are extensive tests that are performed prior to cataract surgery to help patients fall into a category of being a candidate for any one of these particular lens implants. It is not always true that if a patient desires to have a multifocal lens implant that they can have one. Many different things can rule them out of candidacy, different eye diseases and so forth. So that's why we take extensive care to do a very, very exhaustive preoperative workup on folks to help decide what they are actually going to qualify for in terms of technology. And so based upon those data, we can make a recommendation to a patient to help match the technology to their vision goal.
Very good. Any other comments from the surgeons?
I would say that, thank you, Dr. T. Kelly. That was a very good outline. And we talk about this every day in our clinic. And when people find out that they have cataract surgery, we try to explain that it's an easy process to go through. It's the most common operation, but it's also an opportunity. It's this one time in their life that we can change the way their eyes focus. So we go from a discussion about the cataract and how it is causing vision loss, but it truly is an opportunity to both make the vision better. And many of our patients get very excited when they hear that we can reduce or even eliminate the need for glasses for most daily activities. So it turns into a very positive, exciting talk for both the surgeon and the patient.
And I would just add, people that do have cataract surgery, the results are outstanding. People across the board, no matter what type of lens implant they have, after the careful selection process that we go through, they find that their vision is better for their needs. And they uniformly say across the board that surgery is not as scary or bad as they thought it was. And they say cataract surgery itself was a breeze to go through.
I agree with that, Dr. Gary and Dr. Jeff. And I'd also add, too, that many folks after cataract surgery, number one, universally, patients will say how much more clear their vision is, number one. But number two, color perception is significantly enhanced as well. And then when you marry that with an advanced lens implant technology, quality of life is universally improved for patients. And we hear that all the time at our follow-up visits.
Very good. Well, thank you, gentlemen, for taking time out of your day today to educate patients on cataracts. We're looking forward to going back to normal. And we have a ton of protocols that we've put in place to keep both patients and staff safe. We did a video just a couple of days ago that you'll be able to see on our Facebook page regarding all the different measures that we're doing. We're looking forward to being back to normal. Stay safe, stay healthy. We'll see you guys soon.
Thanks.
Thank you, Jennifer.
Thank you.
Thanks.